Hey everybody, it's Dr. Kadisha, your board certified emergency medicine physician, tired after another 24-hour shift. And we can talk about what I saw over these last 24 hours. It was a lot. So I'll just wait for some people to join me in the room. I'm going to put the link. I'm going to be brave today. And I'm going to put the link in the chat box so that you could actually join me for this live stream. The link is in the comments so you can join me in the live stream. So thank you to that first person to join me. It's always great to see the first person. It's always great to see the first person. So let me scoot over, I guess, a little bit. So I got off a 24-hour shift this morning, meaning I worked from 6:30 Saturday morning to 6:30 Sunday morning. And you're probably wondering how that happened. Why are we even scheduled for that amount of time? Before we get into our topic, and typically we are scheduled that way, and paramedics can be scheduled that way also. They're just on, it's like you're on call. And the expectation is that you will get some downtime at some point. You're going to get downtime. You're going to get to sleep somewhere. You're going to get to eat sometime. It's got to happen within that 24-hour period somewhere. Well, sometimes that doesn't always happen, and you are seeing and treating patients for the entire 24 hours, only with breaks to, document what you did for these patients. So, and that's what happened to me this Saturday. I actually worked the entire 24 hours, and it wasn't all COVID. Actually, it mostly was not COVID. And I know that there is the effect of people avoiding hospitals so as to avoid, coming in contact with someone who is infected, like in the waiting room or, just amidst crowded conditions. So, we saw a ton of people yesterday, saw a lot of anxiety yesterday. I think at one point I had 3 people at one time in the ER who had chest pain due to anxiety. They had chest pain with normal EKGs and normal cardiac blood work, and they'd been having the chest pain for, at least a day, some up to 3 days they were having it. So it was clear there was no heart attack going on. But hey, Pastor Johnson, thanks for coming on. So if you folks, if you want to join in for the discussion, definitely, feel free to comment. And we're going to talk about preparing our lungs should we catch a COVID infection. There's a lot of fear and anxiety. And like I said, I had multiple patients in the ER yesterday, all multiple with chest pain, not all of them with chest pain, but, a 24-year-old with chest pain, a 30-year-old with chest pain. They were all under 40 with good-looking EKGs and blood work. And for some of them, they just needed to be in the ER with us or with me or just to see their EKG, and they felt better. But there was a lot of anxiety going on about COVID. There's a lot of anxiety. Anxiety is driving a lot of people to get treatment also. So, we had that. I had a woman who thought she was in labor, and, I did this little talk about pregnancy and COVID Friday night before I went into work. This woman thought she was in labor, but she wasn't, thank goodness. And the funny thing was, I actually had to deliver a kidney stone for a man at like 3 o'clock in the morning. So I think that was hour 21 for me. It's funny how the procedures come in when you've been working for 20 hours with no sleep. So yeah, I had to remove a 1 centimeter kidney stone. That's about the width of the end of my finger from a man's urethra at 3 a.m. in the morning. Thanks, Victoria. I'm not 100% yet, but I, I know I didn't go live yesterday, so I'm trying to stay as close to going live every day, at least every day that I'm off as possible. So yeah, just talk about the shift. And again, we're feeling the effects of COVID, even when we're not seeing COVID patients. I did have to see a health department worker who I'm pretty sure had COVID though yesterday. She had a fever, like a 102.2 temp, was fatigued, had a dry cough, muscle aches, and she worked at the health department. And in her face, you could see the fatigue of her illness. And on the chest X-ray, I did see the white lacy ground glass looking pattern that is characteristic of COVID. I saw that on her chest X-ray. So we're pretty sure that she had it. So we had, anxiety related chest pain. We had a couple of COVID concerning patients. I actually had a patient who had tested negative for COVID twice in the last week who still wanted to come in and get checked out. And it brought up a good teaching point, because not all of us who have fever, dry cough, and body aches have COVID. Not all of us have that. There's still postnasal drip from various bacterial and viral infections. There's still allergies that we're dealing with, asthma, chronic bronchitis. There's still those things going around that are causing coughs that are not COVID. So I hope that helps to allay some of the anxiety that I saw last night. But so things that we can do to protect our lungs should we come down with COVID, I thought was a really good topic. And I had been browsing CNN and saw this great article about some things that we can do to protect our lungs and make the severity of a COVID lung infection less severe should we come down with COVID. So I see more people in the group. Definitely, folks, definitely share this live stream. Yeah, I guess I need to start my own watch party. Because COVID is a respiratory infection. We get it by inhaling the virus particles into our respiratory tract. They attach to our moist mucous membranes, ultimately in our throats and in our lungs. And those tissues, especially in our lungs, are the basis of how we breathe. At the very end of our respiratory tract are these tiny little round structures that look like bunches of grapes, and they're called alveoli. And it's within those little round structures that the amazing happens, that oxygen passes into our bloodstream from our respiratory tract to go to our various organs. And it's also the place where carbon dioxide leaves our bloodstream to enter our respiratory tract to leave our bodies. It's amazing, the alveoli. So guys, please share. And when we inhale those respiratory, those viral particles, those things, they attach there in the respiratory tract, they replicate, and our bodies respond with inflammation. And that inflammation, and you've probably heard it many times, sometimes it's the inflammation itself, our attempt at protecting ourselves, that harms us often when we get COVID-19 and a number of other infections. So why not keep that area sacred? That area should be considered sacred right now more than ever. The very membrane by which oxygen enters our body and carbon dioxide leaves our body should be considered sacred right now. So one of the first things, hey, Dr. Ken, thank you so much for coming on. I really appreciate it. So the first thing that we need to do to help improve our respiratory function, should we ever get COVID, is to stop smoking. And it's more than cigarettes. Any smoky substance that we inhale has some particles. It has some particles that get into our lungs, and just coating that precious membrane where respiratory function occurs, where ventilation occurs, ventilation being the release of carbon dioxide and the intake of oxygen. If we inhale stuff's going to stick to that membrane, and it's going to make that membrane less capable of enabling that exchange of oxygen and carbon dioxide. So it's cigarettes, it's vaping, it's even marijuana, any combustible thing that we can inhale. It can release particles that land in our lungs and coat those membranes. So any of those things, even wood burning fireplaces, candles, those things do release particles in the air. We might not be able to see them or feel them, but if you've ever inhaled any kind of smoke and coughed, it could be the result of you inhaling particles from that smoke into your respiratory tract. Hey, Dr. Dietrich, thank you so much for coming on. I know you've been working hard this weekend as well. So smoking, the cessation of smoking is one way to improve our respiratory function. Another way that we can improve our respiratory function is to reduce mucus buildup. And a lot of old wives' tales say, I know it sucks. Yes, the ambiance of candles is great. I love incense, candles, things like that. I love, some Egyptian musk or patchouli or sandalwood incense. I love that stuff, but and sometimes I go crazy with it, and I can feel the effects of it. So yeah, that was kind of a bummer. So let's see here. So yeah, I know I'm going to get a lot of maybe pushback from those who believe in the benefits of marijuana, but it's still a combustible substance that is not going to help us breathe. Anything that's smoke is not really going to help us breathe. It's not going to improve the function of our alveoli. It's not going to improve the function of our respiratory tract, unfortunately. So yeah, I get it. I felt bad about the incense. I love incense so much. My mom thinks I smoke marijuana, but I just love the incense. So, what can you say? What can you actually say? So, and we can, continue the debate about, smoke and the different kinds of smoke and things like that. So another way to improve our respiratory function to make the possible infection with COVID less severe is exercise. So, exercising improves our cardiac function, our respiratory function. Just the act of cardio makes you focus on your breathing, your deep breathing, the timing of your breathing, things like that. And while your lungs aren't entirely a muscle, still using them in the proper way helps to improve your function. So exercise is another way. And that also kind of helps to clear out mucus and things from your lungs with the level of breathing. Another thing that's number 2. And we can go deeper into things in the coming weeks. Actually, I'm going to start a series of blogs that you can check out on my website, and you could to see the write up of what we discuss here. So reducing excess mucus buildup. A lot of our mothers and grandmothers told us reduce mucus by avoiding bread, cheese, milk, eggs, things like that. And I think that's actually true. One of the physicians that were referred to in the CNN article mentioned that. I know I mentioned it. I've experienced it. It does make a difference. But he also went as far as to suggest some things that help to reduce mucus, things that we can eat to help reduce mucus. And they include like peppers or cayenne pepper, jalapenos, um, spicy foods that have capsaicin. They can help thin our mucus and make it easier to move. Another simple thing is actually just drinking more water, drinking more clear liquids to help keep our mucus thin, reduce congestion, things like that. Those things help to reduce mucus buildup. So avoiding heavy breads, dairy, things like that, that can help reduce mucus buildup. And another thing that we can do is minimize our exposure to allergens. And you may know what those are for you. It would be good for you to know that. Allergy specialists are still available if you find that you're having a weird reaction to something and you don't really understand it, or you end up having an allergic reaction and you end up coming to see me, but we can't figure out what it is that caused the reaction. And yes, that's another tip as far as, helping me help you as far as your expectations of the emergency department. Unless you can tell us that you ate something and within a short period of time you start to have the symptoms, we're not going to be able to find out what it was that caused your reaction. Say, unless it's like you take ACE inhibitors, medications for blood pressure that end in pril, lisinopril, captopril, monopril, those things like that. If you are consuming any of those drugs for high blood pressure, we tell you to stop. If you come into our ER with a swollen tongue, lips, face, or whatever, we're going to assume that your allergic reaction was due to an ACE inhibitor. But sometimes you're going to leave the ER with treatment. You're going to feel a lot better. Your breathing is going to be a lot better, but you're not going to know what caused it. Why not consult or follow up with an allergy specialist so that you know what allergens to actually avoid? This would be a great time to know exactly what it is you're allergic to and what you're not allergic to so that you could avoid it. Let's see here. So that's number 3, and we'll leave it at 3. Those are 3 things. I just want to be kind of concise about this. We've been on for about 18 hours. So let's see what's going on in the comments. Okay, have you ever had patients who claim exposure to mold? And it's funny because mold is so ubiquitous. It can be anywhere, and that might be the last thing that you actually think of. Oftentimes, mold exposure is found after a number of other things have been ruled out. So that's a great time, a great topic to mention. Mold exposure, a lot of us are allergic to mold, but we're not going to find out until we see an allergy specialist or unless we have an obvious reaction to obvious mold. And mold isn't always obvious. And I had a friend who lived in a place and she thought she was allergic to her new cat. She loved her cat. Felt bad about giving up the cat. She gave up the cat and she was still having symptoms. She felt horrible. She gave up her poor cat, still had the symptoms. And it turned out she had mold in her apartment and had to move. So, that was, great topic. We'll have to definitely talk about mold in the future. So again, reducing your exposure to allergens is really important to keeping your lung health at its best, because with the allergens and things like that, again, we can produce more mucus, just like with those certain foods. It causes us to produce more mucus. Those things can clog our airways, making it, harder to breathe, harder to take in oxygen and release carbon dioxide. Sometimes we develop mucus plugs that are so big that you might actually go into respiratory distress or things like that. So asthmatics, definitely keep your asthma under control. If you haven't used your inhaler in a while, check the expiration date, see about getting a refill if you need it. And you don't have to go to your primary doctor's office necessarily. You might just be able to call, and they call in the refill just to prevent to lower your level of exposure. So also, great point. Hey to Jarvis, thanks so much for coming. Yeah, guys, definitely go in the comments if you want to ask a question or express a concern or something like that. So yeah, definitely. Yeah, asthmatics do that. Find your favorite antihistamine. You don't have to take Benadryl all the time. I know it makes people drowsy. There's still other things. There's Zyrtec, Claritin, Allegra, Zizal. I think keep your allergies under control. Keep your mucus at a minimum. Avoid foods that make you congested. Try eating some foods that'll help to thin the mucus and make it more mobile. Let's work on our exercise, things like that. Hot teas daily. I definitely recommend that. It's definitely soothing, and just the warm water definitely helps to reduce congestion and things like that. Because even in the emergency department, say we don't have the need for the albuterol, like the bronchodilators and things like that. Sometimes just inhaling humidified air will help to clear the airways. And sometimes, yes, it's the warmth of the tea, especially if there's no cream in it and things like that. That also helps. But sometimes it's just inhaling the steam itself that helps to clear the respiratory tract and things like that. So yeah, drinking tea versus a glass of milk or a bowl of ice cream will definitely help to improve our respiratory function. So thank you so much for that comment. And let's see, Dr. Dietrich, are you still there? If you're still there, if you want to add anything, yes, feel free to join in on the join me here in the broadcast. Yeah, it's been a while. I know we're we're due for another episode of Perspectives in Primary Care. Let's see. So, and Dr. Dietrich, Dr. Carol, and I, we're trying to do our episodes maybe like once or twice a month now. And Dr. Ken asked, does the weather aggravate underlying respiratory issues? And it definitely can. It depends on, how your sinuses may react to, the changes in atmospheric pressure and things like that. Sometimes often weather changes will bring in an influx of people to the ER with respiratory symptoms due to sinus drainage and things like that. So, and I think my first patient yesterday, I can't believe I can remember my first patient now, but she had issues with her sinuses and didn't realize that it was her sinuses. She thought she was having an allergic reaction. And what had occurred was that I think she went from an area of high pressure to low pressure, and her sinuses reacted to it. So she had been out in like the heat, increasing her body temperature, working out, playing volleyball, things like that. Then she went into the garage and sat in front of the fan to cool off. The next thing she knew, she lost her voice. And then after that, she had swelling of the right cheek. And behind our cheeks, we have large sinuses. We have large sinuses called the maxillary sinuses. And that might be why you have facial pressure, sore throat, nasal congestion, things like that, is because it could be that your sinuses are inflamed. Unfortunately, one of the effects of the sinuses being inflamed is that they drain. They drain mucus into our throats. It causes sore throats. It causes coughs. And depending on how long that mucus is allowed to continue into our lower respiratory tract, we will come down with a cough, shortness of breath, chest tightness, things like that. Another thing that can compromise our respiratory function and make a COVID infection more severe. Let's see. So Dr. Diedrich says, what are your thoughts on Vicks? Yeah, that's a good question. Actually, no, yeah, I didn't get to talk about that. Actually, yeah, I love Vicks actually. I mean, it does help to close. You get the feeling of your airways opening. The menthol, I suppose, it definitely helps. The patient last night actually had some cough drops, and she said that helped her feel like her throat was not as tight. So that was a great question, because it actually helped to relieve some of the symptoms. So yeah, that's a great point. So let's see, guys, any other questions, or does anyone want to join and express any concerns or anything that they had? So yeah, just back to what I was mentioning as far as my shift yesterday. I saw a lot of anxiety. Again, I had like 3 chest pain patients at the same time, all under 40. In the ER, no medical histories, normal EKGs, normal cardiac blood work after having the chest pain for at least a few days. There's a lot of anxiety going on with COVID. And this month is Minority Mental Health Month. So hopefully Dr. Ken will join me next Sunday while we have a discussion of that. He's a board certified psychiatrist. So hopefully we'll be able to discuss those things next week. So a lot of anxiety. There was a lot of abdominal pain also that ended up not being surgical. So I think, and anxiety can sometimes present itself in unusual ways. It can present itself with abdominal pain also, as well as chest pain. So, okay, thanks, Dr. Ken. And let's see, Gary. Yeah, I'm really looking forward to it. Yes, Dr. Ken, please because there's so much going on. I mean, and even our celebrities who are, well sheltered and, rich, nice homes, things like that, they might not be feeling the effects of quarantine like the rest of us, but they're having issues too. We have people who may have attempted suicide. We got people who got shot in the foot by a potentially abusive boyfriend. We've got people who lost their jobs and said they don't want to be on this earth, and these are all celebrities. So Gary was asking, what do you recommend for someone who has chronic sinus infections, who doesn't want to repeatedly take antibiotics? Now, that's a great question, because we're told that a lot of sinus infections don't need antibiotics, but we ER docs, we usually just end up caving in if it's been a long enough time, if your drainage is green, yellow, brown, things like that, you have a significant fever, things like that, then we may consider antibiotics. But for someone who has chronic sinus infections and they don't want to repeatedly take antibiotics, I do recommend seeing an ear, nose, and throat specialist. It could be that you need to have your sinuses manually cleared out, or there could be like a nasal spray or something that they can best recommend to help you get over a chronic condition like chronic sinusitis without antibiotics. That's a great question, because we do want to avoid using antibiotics as much as we possibly can, because we want them to work as best they can for us when we really need them. And one way to ensure that is by not taking antibiotics repeatedly, not taking antibiotics unnecessarily. So, yeah, I would definitely contact an ENT specialist to see what's best. Again, I would avoid food and beverages that I know cause congestion as well. And then if it's not harmful to you, if you don't have hypertension that makes decongestants a problem for you, it might be good to take an antihistamine on a daily basis to help avoid the congestion, like like Zyrtec D or Allegra D. It might be a good thing for you to take it, on a daily basis, so that it really gets into your system and your congestion is controlled on a long-term basis and not like rebounding after the medicine wears off. Just take it every day if you can. Okay. Wow. So I've been on 31 minutes. Any other questions? I really appreciate you guys being here. I really appreciate your questions. I am hoping to speak to a gentleman who was a fellow employee with me for the city of Houston, who just happened to be a people person. And he ended up telling me when I went down there to get my check a few weeks ago, he ended up telling me how as a mid-50s-year-old man, he's got two adult offspring, like in their 20s, who came down with COVID after going to parties and just doing, just living their lives despite the pandemic. So he and his wife, they're middle-aged, and they have two young people with COVID living in their household. And he was trying to tell me how that was, being a person with COVID, comorbidities, chronic illnesses and things like that, just minor stuff, maybe some hypertension, diabetes, obesity, fairly common things, what that was like, having to house two young adults who had COVID in his household. So I'm hoping that we can arrange that just so folks can maybe get a better sense of the reality of this pandemic and what it might be like if you or your loved one comes down with COVID and, just living with it, like really living with it. So guys, definitely go to my website. It's listed here. You can check out my blogs. Also, the best way to deal with COVID is to not get it at all, is to be safe, because again, an ounce of prevention is worth a pound of cure. And I want you guys to be as safe as I can, as safe as I am. I mean, as soon as I leave my place, I have my mask on. So definitely join me, get your masks, have your carrying cases, your mini mobile MD kit. This one fits in your hand. This one is larger. It fits more and it's really cute. But yeah, you can definitely see, I've got your forehead thermometer strips, mask, sanitizer, and there's gloves in here also. So you can see everything that's in it. I like this one, but I know guys like this one because it's more compact, and some guys, a lot of guys like things that are more masculine looking. So definitely get these on my website. You can go to the shop tab and check these out. Be safe like me. Have your stuff prepared in a convenient case here. And even when you use up everything, I'm working on refills. People are asking about those. You can get refills for me, or, at the least, you can carry your reusable mask in these. Masks will fold up and fit into both of these. And so you have something to conveniently carry your mask, like in your purse, your back pocket, your backpack, your glove compartment. Because aren't you tired of seeing your mask hanging from the rearview mirror, or having your mask in the passenger seat, knowing that, someone just sat there, or your mask falling on the floor in the car because you don't have a good place to hold them? So get one of these. That was driving me crazy. So I got these made for myself, my friends, things like that. If you're going out for various services that you can't avoid and there's someone there who's not wearing a mask or things like that, you'll have a mask. You'll have an extra mask that you can share with that person to help keep both of you safe. And that was another reason why I made these, because I was going places that I needed to go where there were people nearby who didn't have masks. And I was able to give them one, and we were both safe. If you want, you can give them one of the little bottles of sanitizer too. You can do that. If you feel like you have a fever going on, you can put a strip on your forehead, give some to someone else also. So these are ways to help keep us and the other people around us safe. Check those out on my website. And please tell me in the comments of other topics that you would like to discuss. Yes, thanks so much, Dr. Ken. Yeah, these things are great for, your family. Like each member of your family should have one of their own. People in your workplace, if you're still working at barbershops and beauty shops, things like that, everybody should have one of their own so they can carry their masks around safely. Just think about that. Your church, if you're still working at your church or things like that. I know that some services are still going on with social distancing, or people still have to maintain church or whatever. So your friends, family, coworkers, your workplace, everybody should have one of these so that we can carry our masks conveniently and, in a safer way. And we can have our sanitizer and gloves should we need it, and even have an extra one for somebody else. Victoria, one of the far-fetched reasons why people say they don't wear a mask is because they say they're building up CO2. Yeah, go figure. I definitely understand, that claustrophobic feeling that people have. There's nobody, holding that mask to you against your will. If it is at all possible, simply distance yourself a little more, go outside, something like that. I mean, I work 24-hour shifts and have to wear a mask. Okay, I work 24-hour shifts and have to wear a mask because, around my coworkers who might be asymptomatic carriers. And then I'm seeing people who almost definitely have COVID. We don't even need to culture them because they have all the symptoms and we can see it on the x-ray. So between all those things, I definitely have to wear a mask most of the 24 hours that I'm there. And what I do is I'll step outside when I get a chance, or, you got to go to the bathroom, take your mask off while you're, in the restroom, take a mask break. Mask breaks are definitely necessary. They're possible. I'm hearing stories about, people who are, working in restaurants and kitchens and stuff like that. You still have to take a break. You still have to take a bathroom break. There are work laws, and, even if it's every 4 hours, you can take a break to take off your mask, or, sit in your car. You got lunch hours, you got, the little 15-minute breaks and things like that. Take your mask off whenever it's safe. No one is saying to, sleep in it. Take the mask off when you can. Believe me, I know I hate the feeling sometimes, the humidity and, having that thing on your face. I take a break. Just take a break. Take a mask break. It's possible. It's simple. It's free. And a properly fitted mask will allow carbon dioxide to escape at a reasonable rate so that it doesn't build up. And Dr. Ken says, yes, surgeons who perform long surgeries wear masks. We need to avoid listening to the catastrophic thinkers out there. And that's true. Yes, indeed. Surgeons are doing 12-hour surgeries. What about them? They've never complained. Okay, they just do what they need to do. And that, worst comes to worst, even they'll scrub out. Someone will step in for them. They got to go to the bathroom. Sometimes you have to take breaks. As human beings, you have to take breaks every few hours anyway. Use that opportunity to take a mask break. Maybe we need to start like a hashtag, something. Yeah, put hashtag mask break in the comments, hashtag mask break, because there are people for years who've been wearing masks for hours and hours at a time, and you've never heard anything about it. Now, if you have a respiratory illness that precludes you wearing a mask safely, or if you are, or people who are not able to remove the masks unassisted, yes, those people are exempt from having to wear masks. Children under 2 are exempt from having to wear masks, but those people still need to engage in social distancing measures. So yeah, if you have a chronic respiratory illness that is so bad that you can't wear a mask, then you need to be home anyway. And we're not saying, you sit around, in your own house wearing a mask unless there's someone there who's sick. I know I see people driving around in cars alone with the mask on, because take it off then. Some people get so used to it, they don't even take the mask off while they're driving. And I'm guilty of that myself. If I'm going from the grocery store to the bank or something like that, I catch myself, sitting there in the car at the stoplight with my mask on. I'm like, man, let me take this off. It's ridiculous. And so is the thought that you're building up too much carbon dioxide. Your body will naturally build up carbon dioxide. And if you're properly wearing the mask, it will escape so that it doesn't get to a toxic level. And worst comes to worst, take a mask break. Step outside, get away from people, maybe get away, maybe 12 or 15 feet. If you can get away, please take off the mask. Wearing the mask is not supposed to be some kind of major, like oppressive type thing. It's not oppressive, it's protective. It's not political, it's protective. It's about protection because you don't want to have a virtual Thanksgiving or a virtual Christmas, do you? You don't want that. Okay, and so Victoria, oh, so nice to see your face. So Victoria says, please tell them at the back of the class, oh, I have to wear an N95 and face shield every time I'm entering any patient's home. Yes, think about those of us who've been doing this for years. We've been doing this for years. Surgeons have been doing it for years. And all we need to do is, just join together. It's not like a matter of reducing someone's freedom. I mean, hell, we're not free right now. We can't travel. Europe doesn't want us over there. How embarrassing is that? Europe doesn't want us over there because we can't get it together as far as wearing a mask. You can't go to Europe because you people can't wear a mask, so we don't want you over here. You can't go to Paris. You can't go to London, Barcelona. You can't go because you Americans can't get it together with the mask. You're being led by someone that won't wear a mask. He doesn't think it's necessary. And you guys have, a bunch of hard-headed people who are going around saying that, the CO2 buildup is too much and it's dangerous. There are so many little common sense things we can do to get around that. People have been doing it for decades. Okay. Yes, indeed. We're, spending more time complaining and less time listening. And we all want to be free. I want to be free to travel. I want to be able eventually to know that I'm going to be able to gather with friends and family at Christmas. I would like that luxury or that freedom. I wish we could see freedom in a different way. I wish we could see it in a different way. So maybe we have to work on that. Okay. All right. So now 45 minutes in, I have 10 people in here. Love it. Love it. Love it. Yeah, definitely hit like, hit share. Please get this message out so that we can be safe, so that we can return to normal, and so that we can enjoy fall, enjoy Labor Day. The head of the CDC said if we could just get control over this mask issue, and in maybe about 8 weeks, things will be turning around in general. Hopefully, we can do that, because we're getting too close to the holidays. I mean, Labor Day is in less than 8 weeks. Tell them that. Ooh, right? Yes. I mean, since we have the government's been so generous with giving the loans, out for small businesses, and I definitely appreciate that. Why not offer $10 to everyone to wear a mask? Or, in some places, there's a $250 fine if you don't wear a mask. And I think Hong Kong is imposing fines that are the equivalent of like 600 or so American dollars if you don't wear a mask where you're supposed to wear a mask. And more people, more and more politicians are calling for a national mask mandate. How do you feel about that? Are we really like herding cats out here? Is it really like herding cats, telling reasonable adults to put a covering over your mouth and nose so that you can have Christmas? Do you want to have Christmas on Zoom? I don't think you want to have Christmas on Zoom. Do you want to have Thanksgiving via Zoom? I don't think so. And, a lot of us have aging parents, and, so every year is precious. And I don't think that you want to spend one of those precious years, away from them just because you don't want to wear a mask. And, personally, as someone that works in the ER, it's getting a little frustrating now because people who aren't wearing masks, who are now getting sick, now they're clogging up the healthcare system now that they actually have it. And it's not fair. It's not fair to us. It's not fair to anybody. I think we do need another shutdown. Gary, actually, the mayor of Houston asked our governor for a shutdown. He asked the governor publicly for a shutdown. And I totally agree. They're making this an issue of freedom. We can't go to Europe. I mean, how about that? You can't go to Europe. You don't know if you're going to have Christmas with your elderly parents this year because of this. Why not? Those are freedoms that we are being deprived of because of this pandemic and our failure to get control over it. So, think about that freedom. Think about the fact that you can't just get on a plane and, like you used to. That's a compromise of freedom. So, guys, thank you so much. I don't want to wear out my welcome, but definitely, guys, please join me, help other people join us and be safe. Get your masks. These are easy ways to keep your masks clean, dry, and out of places where they can be contaminated. I got one for the guys, one for the ladies, or, ladies, guys, or, whatever, guys, ladies, whatever you like. I got it, in these different sizes. It's enough things in there for you to share with at least one other person. And I also have reusable masks on my website as well in colors that everybody should like. Everybody should be able to find something in there. I got camo, black, blue, red, purple. Somebody should like some of those. So, because if we go on a shutdown or if there's a national mask mandate, we're all going to need these masks. Everyone's going to need them. And why not have it so that they're not all over the place and on seats and, blocking your view while driving and things like that. Join me, be safe, do it conveniently. And again, I'm Dr. Khadisha. I'm your board certified emergency medicine physician. It's been 20 years for me. I couldn't go to my med school reunion. I couldn't go to my 20-year med school reunion because of this pandemic. This stuff is real and it's really making me sad and mad. So I'm going to get off. But definitely follow me on Instagram at dr_Khadisha_MD. Thank you so much for being on my Facebook page. And thank you for sharing your time with me tonight. And we'll talk next time. Put in the comments other topics that you would like me to talk about. I want to talk about things that you'll be interested in, things that you'll be engaged in. And maybe, one of you guys will feel like joining me on the broadcast. And, Victoria says, I can't stop it. So Victoria says, Canada doesn't want us. Mexico Come on now. Mexicans are always trying to get in here, and now Mexico was like, no, thank you. And the Bahamas just said no to the US. Yeah. And I believe it because, the Bahamas and places like Jamaica and stuff like that, they don't have the medical resources that we do. So if we go over there and mess things up with a rise in COVID cases, those people will be greatly, greatly affected. They have, it's not like they can just go to another state and go to the hospital or whatever. They can't do that. They have limited hospitals, and as it is right now here in Houston, we have to transfer people 5 hours away sometimes when they need a bed. And like the Houston, the Texas Medical Center, they said today that they're at 103% capacity as far as ICU beds, and we've had to transfer people multiple times to other places. We had to transfer somebody from Houston to Tyler. Houston is in southeastern Texas. Tyler is in northern Texas. Tyler is at least like a 5-hour drive away. Could you imagine being super sick? You have to be hospitalized, and the doctor tells you the closest bed we have for you is 5 hours away. 5 hours away. That's how bad this is, and that's how badly we need to join together and just do what we need to do. Like Dr. Ken says, stop complaining, listen, just put the mask on so that we can get all of our freedom back, and hopefully by the end of this year. Okay, guys, so thank you so much. Thank you again. Definitely go to my website. I got a bunch of things for you there. I think I have a free PDF there for you as well. So, and again, let me know what you'd like to talk about in the future. I'm Dr. Kadisha. Follow me on Instagram, Twitter. Keep following me here on Facebook. Definitely get in the comments. And I will talk to you later. Bye.